been thinking I want to talk to you about something. Menopause. Seriously, though, I had no idea how many things menopause affects. So, like 10 or 11 years ago, I had my second ovary removed due to I grew things on them that weren't supposed to be growing there. Not cancer, but I had to take it. I had already had my first one removed before that, and another surgery to remove a small mass off this ovary. And then I had a baby, and then they had to take the other one. So, it threw me into menopause. No ovaries, menopause. And the doctor prescribed me progesterone and estrogen. And he said, it might not be the right dosage. See how you feel. Give me a call if you think it needs to be changed. Not long after that, I started experiencing depression. I called the OBGYN's office and I said, hey, this is happening. My emotions are all weird. Can I get a change to the medicine? You probably just need an antidepressant. Okay. Well, the doctor told me, like I was just put on this, the doctor told me I might need a different dosage. Okay, so they changed it. Over time, they increased my progesterone, but when they increased the estrogen, I started to have hints of migraine headaches. I was on estrogen to regulate my cycle when I was 13, and it triggered migraine headaches. And my relationship with estrogen has never been very good. So they ended up putting me on an antidepressant. And then I kept having to increase the dosage. And one day I was talking to my counselor, and she said, what you're describing sounds like menopause. I was like, what? Because, like menopause, that means hot flashes, right? Apparently, that's not the only side effect. If you want to know more about this, go check out the Menopause Society. You can look for a health provider in your area who has a specialty with menopause. And I won't get into all of that in this visit, but November, I think, I started on estrogen. Now, because of my history with migraines and estrogen, they gave me and also my skin is sensitive to patches, they gave me a gel. I rub that gel on my inner thigh every day. I can't believe the change. All of a sudden, I'm bursting with ideas. I feel like I got my brain back. Before, it was like, I was just so tired and down, and it felt like my brain just wouldn't quite work right. Now, this is February, so within 4 months, and they did increase the dosage the last time I was in there. So within 4 months, I am decluttering and reorganizing my entire house. Really, it's changed everything for me. I feel like I'm back. And I'm going to talk to the psychiatrist about whether or not we can see about getting me off of these meds. I don't have a history of depression and anxiety before any of this, before that surgery. Right, you feel depressed after a bad boyfriend breakup or or my grandpa died, but that's event driven. I'm talking generalized anxiety and depression. They diagnosed me with that, but maybe they should have diagnosed me with menopause. Unbelievable the difference it made. If you don't have a history of mental illness and you're female and around my age or a little, menopause age, check it out. Don't just go to your OBGYN. Check out the Menopause Society or listen to anything by Dr. Mary Claire Haver. It is mind-blowing, all the things that are related to menopause and the fact that something can be done about it. Mind-blowing. So I'm no expert on menopause by any stretch of the imagination, but let me tell you, if you're feeling like your brain left you and you don't know why, and you're experiencing a lot of depression, no energy, consider it. Consider going. Again, it's the Menopause Society. That's the website. You can go in there. You can put in your zip code. I think they're international too. I live in the U.S. right now, but I'm pretty sure they're international. But at least for the U.S., you can put in your zip code and find the nearest provider. Check it out. Do yourself a favor. Do your family a favor. The Menopause Society. Life-changing, I'm telling you.